Oh, that's what Papa Nkechi is taking. And he has BP. Yeah, that drug that is round. So now that they said my BP is high, I think that's what I should get. Hi everyone, this is Farm Good Luck right here. Welcome back to my channel. So today is World Hypertension Day. So I just want to bring in a twist. When days like this come up, we try to create awareness on you checking your blood pressure, and getting the appropriate medication. So the twist today is you that you've checked your blood pressure and your blood pressure is high. What actions have you taken about it? You that your doctor have prescribed a drug for the past 5 years and you've been sticking to that drug, yet the blood pressure hasn't come to normal. I mean, you go to the pharmacy or you go to a nearby hospital and you check your blood pressure, it has not come to normal. What have you done about it? Yeah, that's the category of people I'm here for. Now, blood pressure is due to the pressure applied on the blood vessels. You get? So when this pressure is applied on the blood vessels, now the blood vessels kind of find it difficult to transport blood to the various organs and necessary cells and tissues that needs it. You get my point? I mean, transporting the blood from the heart, to the various part of the body that requires it and the adequate amount. So when this transportation is impeded due to the pressure build up, of course there are a lot of factors that can lead to this. That's when the blood pressure that's when the pressure gets high, and that's when the reading gets high. I don't know if I make sense. Yeah, so that's it. So in the treatment of hypertension, first of all, there are modifications that you can actually make. Actually, the first line treatment of hypertension is your lifestyle modification, dietary intake modification, limiting your alcohol use, exercise, cutting down on your weight if you're on the high side. Yeah, cutting down on your weight. That's like the first line medication for hypertension. Now, the decision to initiate an antihypertensive medication, I mean the pharmacological approach of treating hypertension, is usually due to the level of your BP, and also if you're in a higher risk of developing like cardiovascular diseases. Yeah, you can be in a higher risk when you have comorbidities. I mean, like diseases like diabetes mellitus, hyperlipidemia, that is high cholesterol, when you're obese, like your BMI. Okay, that's a topic for another day. But I mean, there are some kind of conditions that you may be having together with a high blood pressure that will just warrant you getting medications for your high blood pressure ASAP, without even first considering the non-pharmacological approach. So that being said, if you have been diagnosed of hypertension, that is high blood pressure, you should be compliant with your medication. You should get a blood pressure monitor. This cannot be overemphasized. At times, you may really get well accustomed with how your body works and when to know when is high and when to know when is not high. But my dear, there are some times that your body may be lying to you. So until you check, until you read the value, you do not know what your blood pressure is saying. So get a blood pressure monitor. All this being said, indulge in a healthy lifestyle. Maintain a good eating habit. Diet low in sodium, high in potassium. Exercise regularly but moderately. Emphasis on moderately. And of course, adhere to your medications. And if your medication is not, getting your blood pressure to the normal range, the normal range is actually the systole, that's the higher the upper reading rather, being lower than 120, and the lower reading being lower than 80. This actually varies with age. I'm going to put up a chart at the end of this video so you see what I mean. Yeah, so if your medications, they are not bringing it to this level, to this normal range, or something close to this normal range, you have to seek the advice of your healthcare professional, your medical doctor, whosoever person that you've been consulting. Yeah, a licensed healthcare professional. You have to seek the advice of the person, and the person will take it up from there, because the idea is to bring your blood pressure to normal. You cannot just live with that high blood pressure. Yeah, you cannot. I remember having a patient that he takes amlodipine. Yeah, he takes amlodipine each time he comes to the pharmacy. He gets amlodipine. That's like his routine medication. So each time this guy comes there, actually a young guy, yeah, he's a young guy, each time he comes to the pharmacy, his blood pressure is usually high. So I had to take it up upon myself. I told him that, see guy, this medication is not doing what it should, probably due to your kind of your genetic makeup or whatsoever reason. Yeah, so I had to supplement the amlodipine with a different antihypertensive, and just taking it for straight 3 days, because when you're doing such things, you usually place the patient for like maximum of 3 days, just to know how far he's doing with the medication. So after the third day, he came back, he checked his blood pressure, and wow, the blood pressure came to normal. So since then, he has been maintaining these two medications, amlodipine and the drug that I introduced him to, and of course he checks his BP as required. Yeah, I hope this video was as impactful as I enjoyed making it. All right, see you next time. Bye.